Have you ever stared at an NCLEX question and wondered, should I hold this medication? Should I question this order? Or is it safe to give? Now, medication safety trips students up every single year, and it doesn't really have to. So today, I'm going to teach you the exact red flag cues that tell you when a medication is dangerous, when to stop something, and how to know if you should not give a medication even if it's ordered. So this is lesson 5 of the clinical judgment and prioritization series. Let's make safety finally make sense. Alrighty. So why medication safety comes first? Before you pick an answer on the NCLEX, you must ask one question. Is it safe to give this medication right now? Because a medication given at the wrong time to the wrong patient with the wrong vital signs can kill a patient faster than almost anything. And NCLEX wants to see one thing. Can you recognize danger before you administer anything? So let's break it down. So medications fall into 5 high-risk categories on the NCLEX. Number one, medications that affect blood pressure or perfusion. Those will be your antihypertensives, your diuretics, your beta blockers, your ACE inhibitors, even opioids can drop your blood pressure. So the red flag for those medicines would be a systolic blood pressure less than 90 or a MAP less than 65. So what a MAP is, it's a mean arterial pressure. And that means that it's the pressure that actually pushes blood into the organs, especially the kidneys, the brain, and the heart. So if the MAP is less than 65, that should be telling you that the organs are starving, the kidneys can't filter, the brain doesn't get enough oxygen, and the heart is getting low perfusion. So if the pressure is already low, you giving these medicines will cause shock. And this is why you hold the blood pressure medications when the MAP is less than 65 or when that systolic blood pressure is less than 90. Because when you do, especially with the MAP is telling you that the organs are already in trouble. So if you give these medications, it's going to make it worse. Number two, medications that affect heart rate or rhythm. Those would be digoxin, your beta blockers, your calcium channel blockers, um, your anti-arrhythmics. Um, and the red flags for those medications would be if a patient's heart rate is less than 60, if their PR interval is prolonged, if they have an AV block, or a new dysrhythmias. Because these medications can push the heart into dangerous bradycardia, and you definitely don't want that. Then you have the medications that affect potassium levels. So furosemide will lower potassium. Spirulactone will raise potassium. ACE inhibitors will raise potassium. ARBs will raise potassium. Insulin plus glucose will actually lower your potassium. So the red flags would be if your potassium on your patient is higher than 5.5 or it's lower than 3.0, then you have to know that high potassium causes deadly dysrhythmias and low potassium can cause lethal arrhythmias. Okay, number 4, um, medications that affect renal function. Those would be your NSAIDs, metformin, vancomycin, gentamicin, IV contrast dye, lithium. And the red flag for those medications is if the patient's creatinine is rising. So if that creatinine is greater than 1.3, it's letting you know that the kidneys can't clear it. And so these medications will become toxic. And last, the medications that affect respiratory status. That'll be your opioids, your benzodiazepines, sedatives, and your anesthesia agents. And the red flag for respiratory status is a respiratory rate less than 12 or an oxygen saturation less than 92. If a patient has new confusion or if they have CO2 retention as those with COPD. Because understand, a low respiratory rate plus a sedative can put your patient in respiratory arrest. All righty. Now, the safety rule. If a vital sign is below the safe range, or if the patient's labs are unstable, hold the medicine. Okay. So let's match the medications with the dangers. Number one, If your blood pressure is too low, hold medications like lisinopril, losartan, metoprolol, um, carvedilol, furosemide, morphine, or your opioids. Why? Because these will drop your blood pressure in your patient further, putting them into shock. So the safe rule is do not give if your systolic blood pressure is less than 90. Number two, if the patient's heart rate is too low, you're gonna hold digoxin, metoprolol, diltiazem, amiodarone. So if the patient's heart rate is lower than 60, hold these types of medicines. Number three, hold if your potassium is unsafe. You will hold medications like spironolactone because that will raise your potassium. ACE inhibitors because that will raise your potassium. ARBs because that will raise your potassium. And furosemide when your potassium actually is low. So furosemide will make your potassium level lower. The other three medications that I mentioned will increase your potassium level. Number four, hold nephrotoxic medications if your creatinine is high. And medications you would be holding are like metformin, vancomycin, gentamicin, NSAIDs, IV contrast dye, lithium. Because if your creatinine is greater than 1.3, it means that the kidneys are struggling. So stop, you're going to stop these medicines, you're going to hold these medicines and call the provider. And number five, you're going to hold sedatives if your respiratory rate is low on your patient. So you're going to hold morphine, oxycodone, hydromorphone, um, lorazepam. Remember, respiratory depression kills fast. So if your patient's respiratory rate is less than 12, hold these medicines. Do not give them. Now let's look at your high risk labs. There are labs that you must know before giving any medications. So with your potassium, your potassium has to be between 3.5 and 5. So if it's greater than 5.5, you will not give potassium raising medications. If it's lower than 3.0, you will hold potassium lowering medicines. For your creatinine is the range is zero point 0.6 to 1.3. So if your creatinine level is high, that's letting you know that there is kidney injury. So you're going to hold nephrotoxic medications. Your sodium, 135 to 145. If there is a sudden drop, your patient is at risk for seizures. So if the patient's sodium is low and the provider has like a thiazide diuretic, you will hold that medicine and call the provider. Digoxin level. The normal range is zero point 0.5 to 2. Anything greater than 2 is toxic. And your INR for warfarin or Coumadin. The normal range is from 2 to 3. That's therapeutic. Anything 4 and higher is your patient's at a dangerous bleeding risk. And so you're going to hold your warfarin if your patient's INR is greater than 4. Now let's look at some scenarios real quickly. Scenario 1. The order your doctor gives or your provider. Give metoprolol 25 milligrams by mouth. You assess your patient. Their blood pressure is 88 over 54. Their heart rate is 62. So what are you going to do? You're going to hold the medicine. You're going to question the order and you're going to call your provider. Okay. Number two, and um, you have an order to give furosemide, 40 milligrams IV. You assess your patient. The potassium is 2.9, the blood pressure is 110 over 72, and your patient has edema. What are you going to do? You're going to hold that potassium because it's too low. Because you're going to call your provider because you need to address that low potassium first. Um, Third scenario, give morphine 2 milligrams IV for pain. But you assess your patient, and your patient's respiratory rate is 10, the oxygen saturation is 89%, and they're confused. What are you going to do? You're going to hold the medicine, you're going to call the provider, and you're going to prepare to administer oxygen and evaluate for any respiratory depression on your patient. And the fourth scenario, you have an order, you're going to give metformin 500 milligrams by mouth. You do your assessment, the creatinine is 1.9, and your patient is receiving contrast dye tomorrow. What are you going to do? You're going to hold that metformin because you're going to put your patient at risk for lactic acidosis and you're going to call your healthcare provider. Now let's do a quick mini challenge. Which medication must you hold? Okay. Warfarin, the INR is 4.8. Lisinopril, the blood pressure is 102 over 78. Spironolactone, the potassium is 5.9. Metformin, the respiratory rate is 18. And diltiazem, the heart rate is 54. So these are the medications, and then you do your assessment. And so, which medicines would you hold? You would hold the warfarin because the INR is too high. You're going to hold the spironolactone because the potassium is too high. And you're going to hold the diltiazem because the heart rate is too low. And yes, three correct answers. You know those select all that applies. That's NCLEX style, okay? And so for a wrap up, hopefully you have a better understanding of how to recognize, the exact medication red flags that the NCLEX loves to test. You have to remember, check your vital signs first, then check your labs. Anything unsafe, hold it, and think safety before speed. I think a lot of times we want to just be fast and get things over with, but we have to be safe. Medication safety isn't about memorizing drugs. It's just about recognizing danger. And so, if you enjoyed this video, please go and like and subscribe, hit that notification bell. Um, please go to NurseEdScholar.com where you can download the clinical judgment workbook for more medication scenarios, red flags, and rationales. And don't miss lesson 6, the final lesson for the clinical judgment and prioritization series. Um, it's the S bar communication and putting it all together. You know, you're learning to think like a safe and confident nurse. And I'm so proud of you. Keep going.